This module is used to present general information on the emerging area of physical activity and inactivity as risk factors for cancers. Physical inactivity is emerging as a very important risk factor for cancer, particularly colon and breast cancers. The prevalence of various site-specific cancers could be emphasized in the discussion of this module. Although the biological mechanisms have not been clarified for the connection between physical activity and cancer, several plausible hypotheses exist. Moreover, we have learned much in recent years about the beneficial effects of physical activity on quality of life and other outcomes among cancer survivors. As cancer treatments become more effective, more and more people will be cancer survivors. The first question you may want to ask is, what is cancer? By definition, cancers are disease processes associated with uncontrolled abnormal cell growth and proliferation. Cancer is a general term for a number of conditions in which cells grow out of control, including partial or complete lack of structural organization, lacks functional coordination with the normal tissue, and usually forms a distinct mass of tissue that may be either benign or malignant. Cancers are caused by both internal factors like heredity, immune dysfunction, abnormal metabolism, and external factors such as behaviors such as smoking and a sedentary lifestyle. Radiation exposure. These factors can act alone or in synergy over time to produce carcinogenesis. Cancer is actually a group of diseases, each with its own risks, etiologies, and pathologies. Affected cells multiply locally or systemically in a rapid, uncontrolled manner. Cancers were the second leading cause of death in the United States in 2009, affecting 45% of men and 38% of women during their lifetimes. Only about 10 to 15% of cancers are linked to heredity. The remaining cases are thought to be related to external factors such as lifestyle or environmental factors. In the United States 2009, 1,500 people per day were predicted to die from cancers. Cancer accounts for 25% of all deaths in the United States. The estimated death from cancers by site and gender in 2009 for the United States are shown in this table. In detail, lung and bronchus is the most occurred cancer for both males and females. Prostate cancer is the second most cancer in males, while breast cancer is the second most cancer in females. Globally, cancer killed an estimated 7.6 million people in 2007, and the rate is expected to increase to 17.5 million as a result of the growth and aging of the world's population. Research has demonstrated that many cancers may be due to health behaviors and thus, are theoretically preventable. The American Cancer Society estimated that one-third of the projected 562,340 U.S. deaths from cancers in 2009 would be related to lifestyle factors such as overweight and obesity, physical inactivity, and unhealthy eating. Common risk factors for most cancers include age, physical inactivity, obesity, heredity, sex, tobacco use, sun exposure, and poor nutrient intake. So what are 5 common risk factors associated with the development of most cancers? Describe them. Answers may vary but include the following. Physical inactivity emerging as an important risk factor for several prevalent cancers. Meeting physical activity guidelines may lower the risk of developing these cancers. Obesity. As with cardiovascular disease risk, having a BMI greater than 25, overweight or 30, obesity significantly increases the risk of most cancers. Tobacco use. Chronic smoking is associated with lower levels of aerobic capacity and functional health. Tobacco use was associated with 169,000 cancer deaths in 2009 and is the main risk factor associated with cancers of the lung and bronchus. Poor nutrient intake. The consumption of a diet that is low in essential nutrients, for example, those found in fresh fruits and vegetables, practicing risky behaviors, for example, excessive alcohol intake, or both, can increase the risk of cancers. Sun exposure. Excessive exposure to the sun's rays and indoor tanning, for example, non-ionizing radiation, are the primary risk factors associated with skin cancers. Toxic environmental exposure. Long-term exposure to environmental toxins such as chemicals, ionizing radiation, and infectious diseases can increase the risk of most cancers. Age. The risk of developing cancer increases the longer one lives, because most cancers develop over time from damaged genes. The majority of cancers, 70%, occur in adults who are over 55 years of age. Genetics. Although cancer risk depends somewhat on genetics, engaging in positive behaviors such as being physically active, eating healthfully, maintaining a healthy weight, and minimizing risky activities can lessen overall risk by improving functions such as circulation, ventilation, bowel transit time, energy balance, and immune function, and DNA repair. Sex. Some cancers are sex-specific. Prostate cancer in men and reproductive system cancers in women. Ovarian, endometrial are examples of sex-specific cancers. What are the barriers to reducing these risks? Cancer will lead to a variety of effects to individual's body, including but are not limited to fatigue, weight changes, urinary bowel problems, peripheral neuropathy, osteoporosis, cardiotoxicity, lymphoedema, hot flushes, night sweats, anxiety, depression, and difficulty with memory. In addition, cancer and cancer treatment often cause a variety of side effects such as anemia, attention, thinking, and memory problems. The patients are encouraged to talk with their doctors about which side effects are likely based on the specific treatment plan. An important part of cancer care is relieving side effects, called symptom management, palliative care, or supportive care. It is important for the patients to talk with the healthcare team about the specific side effects they experience and the best ways to manage and treat them. Here we need to know the different types of treatments for cancer. Then, which types of cancer treatments are available now? There are many types of cancer treatment, such as surgery, radiation therapy, chemotherapy, immunotherapy, hormone therapy, stem cell transplant, precision medicine, and targeted therapy. The types of treatment that patients receive will depend on the type of cancer they have and how advanced it is. Some people with cancer will have only one treatment, but most people have a combination of treatments, such as surgery with chemotherapy and/or radiation therapy. When the patients need treatment for cancer, they have a lot to learn and think about. It is normal to feel overwhelmed and confused. But, talking with the doctor and learning about the types of treatment the patients may have can help them feel more in control. Well, can you give an example from the real work experience? This slide demonstrates the acute and chronic treatment effects of some commonly used treatments. When used to treat cancer, surgery is a procedure in which a surgeon removes cancer from your body. The acute effects include pain, lymphedema, fatigue, and limited range of motion, and the chronic effects are pain, loss of flexibility, and nerve damage. Radiation therapy is a type of cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. The acute effects include pain, fatigue, skin irritation, and pulmonary inflammation, and the chronic effects are a bit different, including scar tissue buildup at radiation site, loss of flexibility, and fractures. Chemotherapy is a type of cancer treatment that uses drugs to kill cancer cells. The acute and the chronic effects are listed in the table, including weight gain, fatigue, and bone loss. Immunotherapy is a type of treatment that helps your immune system fight cancer. The acute and the chronic effects are listed in the table, including weight gain, fatigue, nerve damage, and skin changes. Which cancers can be prevented by regular participation in physical activity and exercise? As noted by the physical activity guidelines, the relationship between physical activity and reduced cancer risk has been found most consistently for breast cancer and colon cancers. Emerging evidence suggests an association between being physically active versus inactive and a lowered risk for lung and endometrial cancers. However, little evidence supports relationship between risks for other cancers and physical activity. Research evidence shows that cancer survivors die of non-cancer causes at a higher rate than general population. Exercise regularly is beneficial to the cancer prevention. According to Irwin in 2009, those breast cancer survivors who exercise regularly would have a 24 to 67% reduction in total deaths, and 50 to 53% reduction in risk of breast cancer deaths. Those colon cancer survivors who exercise regularly would have a 50 to 63% reduction in risk of total deaths, and 39 to 59% decrease risk of colon cancer deaths. Although strong scientific evidence supports a dose-response relationship between physical activity and lower risk of breast cancer and colon cancer, the specific physiological mechanisms by which this lower risk might be operating are unknown. Speck and colleagues published a systematic review and meta-analysis on the update of controlled physical activity trials in cancer survivors in 2010. This systematic review and meta-analysis evaluates the extent to which physical activity during and post-treatment is appropriate and effective across the cancer control continuum. Data from 82 studies were abstracted, weighted mean effect sizes were calculated from 66 high-quality studies, and a systematic level of evidence criteria was applied to evaluate 60 outcomes. Quantitative evidence shows a large effect of physical activity interventions post-treatment on upper and lower body strength and moderate effects on fatigue and breast cancer-specific concerns. A small to moderate positive effect of physical activity during treatment was seen for physical activity level, aerobic fitness, muscular strength, functional quality of life, anxiety, and self-esteem. With few exceptions, exercise was well tolerated during and post-treatment without adverse events. In conclusion, evidence suggests many health benefits from physical activity during and post-cancer treatments. Additional studies are needed in cancer diagnoses other than breast and with a focus on survivors in greatest need of improvements for the health outcomes of interest. In terms of the effects of physical activity participation on cancer survivors' biological markers, it has been proposed to improve body composition and insulin levels. Physical activity is posited to affect body composition and adiposity. These changes in body composition lower cancer risk indirectly by changing factors associated with higher body fatness, such as positively affecting biomarkers of systemic inflammation, improving insulin resistance, increasing blood insulin level, and lowering the production of sex hormone. As known, increased insulin levels are linked to increased risks of death. If physical activity participation leads to 25% decrease in insulin levels, which in turn results in 5% increase in survival rate,